Hello everyone, this is Dr. Sue from Purely Pediatrics. Thank you so much for tuning into this week's discussion, and today I'm going to be talking about dog bites. Dog bites are something I wish I didn't have to talk about, but it happens so frequently that I do want to make this part of our content. The biggest recommendation I have is preventing dog bites, preventing your young children or even your older children from feeling that they have full access to the animal that you own, whether it's your dog or somebody else's dog. I want you to please remind your kids never to put their face by a dog. Dogs are unpredictable. And they just are. They're animals. They're absolutely wonderful, and they can provide us so much joy and peace. But we need to appreciate the fact that we don't fully understand their communication. And oftentimes, when they have somebody put their face by them or they have a child crawling on them, they don't know how to communicate the fact that they are threatened. And sometimes that communication comes off as a bite. So I do want you to remember that prevention is key. Always remind children of every age not to put their face by a dog. If a dog is chewing on a bone, make sure that child knows to stay away from that dog. That is not something that should ever be allowed. And if you feel like that's something that you can't control, then don't give that doggy bones to chew on. It's important that we respect them as animals, and that's the one thing that I unfortunately see not happening. And what I'll see is many families will post videos of their children, their infants pulling on dogs' ears or pulling on their dog's hair or climbing over their dogs. And every time I see that, I cringe. And I just can't reiterate enough that is never, never acceptable. And please, please remember that. So, unfortunately, if a dog bite does occur, what we need to do is make sure we fully separate that child from that dog. And oftentimes the dog, especially if it's a family dog that caused the bite, the family dog will actually run away and hide. I want to start off by saying what you want to do is make sure you calm yourself down and get whether it's a damp paper towel or a damp washcloth, make sure to hold that washcloth or the paper towel onto the site of the bite. If it's too extensive and this is unfortunately very severe, then that's when I want you to call 911 and then let them help with this. The severity of dog bites can be very different depending on the size of the dog, the size of the bite, the depth of the bite, and the multitude of bites. So I can't unfortunately tell you exactly what to do for every dog bite because they can all be very different. Dog bites in themselves can sometimes require repair, and that's something that your pediatrician will be able to help you manage. At the pediatric urgent care, we are able to manage dog bites, and if we can't manage them, we will send you to the hospital in order to get that taken care of. But what I want you to do is always start off with your pediatrician once this happens. We want to make sure that we keep our dogs fully vaccinated, particularly for rabies. And that is going to be very important because that's the first thing your doctor will ask you is if your dog is up to date with shots, and your pediatrician will also ask if your child is up to date with shots. Tetanus especially is something that they will want to look at, whether your child has received the DTaP or the Tdap, and that will be something that will be managed on a case-by-case basis. Once you are able to actually take a look at the wound, I want you to take a good look and be able to make sure that bleeding stops. And sometimes it can take a couple of minutes of compression to hold that wound tight with that paper towel or the washcloth in order to get a good look. Sometimes these wounds look very significant, and it's really just due to the bleeding. No matter what kind or size of wound it looks like, always make sure to reach out to your pediatrician to help. When I see children at the urgent care for dog bites, and unfortunately this is a very common scenario, and oftentimes it is on the face, and that's why I want to reiterate again to keep your kids' faces away from your dogs as best as you can. What I do is we make sure we clean the wound out well, and there will be times that we need to have suture repair done for that wound. Glue is something that should never be done on a dog bite, because what you could do is actually hold that infection inside, and we don't want to do that if it does get infected. You may find that when you take your child in for a dog bite that we just kind of loosely suture. We never put real tight sutures in because we want to leave some area for infection to escape if that does occur. And oftentimes pediatricians will decide to start your child on antibiotics. Augmentin is the primary antibiotic that we use, and if your child does have an issue with penicillin allergy, then there are 2 other antibiotics at the same time that we do have to resort to. So that will be something that your doctor will be able to talk to you about at that time as well. There are, the Department of Health also has a dog bite form that when you do take your child in, if you do unfortunately have to deal with the dog bite, the Department of Health does recommend that all of us as providers of medical care do fill this out for the Department of Health. It does not mean they're going to come and take your dog. It does not mean they're going to come and take your neighbor's dog. But it does mean they're going to help manage any possibility of rabies exposure with you, and they're going to help manage this situation. So I always have this form that we start filling out at the nurse's station when you come into the urgent care of the hospital for a dog bite. It's important to know the details as much as we can. If it is a dog that you don't know or it's a neighbor's dog, try to find out the information that you can. Don't be afraid to talk to your neighbor. Don't be afraid to ask about the immunization records. If that dog was not vaccinated for rabies, that puts a whole nother spin and is a game changer on the management of the child or the adult with regard to dog bites. If your pediatrician does want to start antibiotics, it's usually for good reason. I do ask that you allow them to do so. And just know that dog bites can become infected quite easily, particularly on the face. We want to make sure that we manage that closely together. So that's something that we will be in close communication with, as well as your own pediatrician will be in close communication with you with regard to dog bites. So to end in this, I want to make sure you know, first of all, prevention is key. Second of all, if anything happens with the dog and the child, I want you to make sure that you have them separated. Really look into why this occurred and think about how we could have done things a little bit differently to prevent this, not only for the child but for the dog as well, and reminding ourselves that these are animals. They are unpredictable, and we should never try to predict how they feel or think. If your child does unfortunately receive a dog bite, give your doctor a call. The pediatrician will possibly send you to the hospital or the pediatric urgent care for care. And we oftentimes know exactly what to do for these kinds of issues. So hopefully you never have to deal with this, but if you do, then I'm hoping that this video with audio will be helpful for you. Thank you so much. You guys have a wonderful day, and I'll see you next week.